Yeah, well, health is wealth, and of course, human resources is one of the major resources any country can boast of. So, no wonder we see state governments and even the private sector looking into boosting human resources and health, the health sector. Of course, that's a major one, apart from the fact that, of course, there's also revenue to be made. From that sector. Reports say that Nigeria may be becoming a hub for international medical tourism, as we see more high-tech equipment being given to different hospitals, and especially the private sector, obviously, is driving that. And so we see more population coming that way. But of course, it's not yet time to relax. We still have a lot to do. We still hear of our elites, big men out there, you know, going for medical checkup, even in the political scene. So I guess we still have a whole lot to do. But talking about celebration, Nnamdi Azikiwe Teaching Hospital is celebrating 2 years after moving to their permanent site. And they say this is a big deal for them. That's why we have the Chief Medical Director of the teaching hospital, Professor Joseph Ugwaja, in our Abuja studio to tell us how they intend to celebrate this and why this stands out. Good morning, Doctor, and welcome to the program. Hello, Professor Ugwaja, can you hear me?
Welcome to the program. I can hear you clearly.
Looks like
Sorry.
we're having a bit of tech. Prof, can you hear me? Looks like we're having a bit of technical issues there. We hope to be able to get him soon. Prof, can you hear me? Professor Ugwaja, can you hear me?
I can hear you.
Oh,
I
great.
can hear you. You can go on, please.
Oh, great. So first we'll say congratulations on this second anniversary of relocation to your permanent site. What does this mean to you, to the institution? Because it's not your second anniversary, it's just the second anniversary of your relocation to the permanent site. So perhaps you can share with us what you've been enjoying since you moved to that site.
Okay, thank you. We'll be celebrating our second anniversary of our relocation to the permanent site on the 10th. And so, for us as a people, just like happened in the Bible, when the Israelites left Egypt, and so every year, we try to commemorate and remember when we left our old sites for the permanent sites. You recall that our hospital had been at the old site for almost 30 years before I came on board as the CMD. I became the CMD in 2021, and we said that we won't continue here. And so we developed a new vision for our hospital. And that vision we've actually propagated, and everybody knows about it. We said we want to be among the best in the country, specifically to rank among the 3rd best hospitals in the country, ultimately becoming the best hospital in the country, and even Africa, because we failed at the time that it was doable. And of course, that vision cannot or could not take roots at the old site, because the old site was a small hospital, about 200, 300 beds, you know, old buildings and all that. And then we had a permanent site that has not been developed because of lack of resources. And so we spoke to ourselves, we put together our team. That was in 2021. And we developed our strategic plan. And we had 9 pillars, clearly. Of course, infrastructural development of that permanent site was a priority. And then we started. And we got on our side with the assistance of the stakeholders, especially the federal government and the Federal Ministry of Health. We were able to commission that site in 2023. That was 2 years down the line. And we relocated from the old site to the new site. That new site, as we speak today, is about 1,500 bed capacity hospital. And so, you see about 5 to 6 times the old site. And so each year, we celebrate that relocation from the old site to the new site. Not just the celebration. It's about reminding ourselves the compact we have Nigerians. It's about reminding ourselves the mandate we have with God and humanity. So it's not about relocating to the new site. The new site is bigger. It's an entirely new facility. It's very comfortable. The ambience is perfect for quality care delivery and all that. But that is not it. It is about the ability to offer quality healthcare services to the people. And so we keep talking to ourselves. It's not about coming to the permanent site. How have we fared in the last 1 year? Have we been able to improve on our outcomes? Have we been able to improve on our satisfaction rate among the patients? What have we even added to where we were? And so all those assessments, we make it every year. And importantly, we also use the opportunity to commission some of our projects and recognize some of our staff. So it's all about reminding ourselves where we are coming from, but more importantly, the compact we have with Nigerians, our mandate to deliver quality and affordable healthcare to Nigerians in line with the federal government mandate, of course, in line with the Renew Hope agenda of Mr. President, and of course, with the mission and vision of the ministry. So that's what we do. So every year, we do that. So this year's program is going to be held on the 10th. And we are lucky this year that the Vice President, His Excellency, Senator Kashim Shettima, GCON, is going to be in attendance to help us commission one of the best complexes you can see in any teaching hospital in Nigeria. That is our new administrative complex, which we termed the President Bola Ahmed Tinubu Administrative Complex. So he is also going to help us commission that particular complex. And then, of course, honor one of the giant philanthropists and benefactors we have in the Southeast that has actually helped us a lot and did a wonderful complex for us. That is Prince Arthur, who did a mother and child complex for us. So the Vice President is going to help us, commission that particular complex and then honor our staff who have been helping us. So in a nutshell, in summary, the anniversary is a celebration for us. It's a reminder for us where we are coming from. It is also a statement of what we are here to do, a statement of what the permanent site means to us, a statement and a recommitment of ourselves to our pledge with the Nigerian people to provide quality and affordable healthcare services to the people. Of course, this year's anniversary, we're going to witness a lot of guests. The Honorable Connecting Minister of Health and Social Welfare is going to be there, Professor Mohammed Ali Pate, CON. Of course, the state governor is going to be there. Professor Chukwumacha Soludo is also going to be around. And then members of the National Working Committee of All Progressive Congress are going to be there. My board chairman is the Deputy National Chairman, who has actually been of assistance. In fact, since he came on board about 2 months ago, we are beginning to see a new lease of life at the hospital. In fact, he's coming in with a new dimension in board chairmanship, in the dynamics of board chairmanship and management relationship, because he has brought a whole lot of new energy, positive energy into the system. In fact, the coming of the Vice President was actually largely facilitated by him and his colleagues in the National Working Committee. So these are the kind of things we want to see. Times we are aware when you have board chairmen who do not understand the vision of their institutions, and so you start having conflict early in the day. But we are quite lucky to have a man who understands what it means to be a board chairman, that what he is here to do is to add value. So immediately he came, he started linking us up with stakeholders, linking us up with people who are going to help the institution, to the extent that we were able to be linked up to the Vice President of the country, who is coming to commission projects for us. So we are celebrating everybody, but more importantly, we are celebrating the President of the country, Professor Bola Ahmed Tinubu, who has been of immense help, not just to the teaching hospital, but to the Nigerian health sector as a whole. For the first time, we are beginning to see more funding coming into the health sector. We are beginning to see encouragement and support from the presidency for the health sector. We are beginning to see new lease of life for us. I've been a while in the health sector, so I know what it means. So we are celebrating him. That's why we are naming our administrative complex after him, to encourage him in what he's doing, and also to tell Nigerians what he's also doing in Nigeria and then in Southeast. So that's what we are doing. Thank you.
Well, I can feel that there's a lot of excitement and awe in all of this celebration. But, you know, how will this change maybe services at the hospital after this, and the vision of the hospital? How does this celebration move that, you know, closer to the people or closer to reality?
Okay, thank you very much for that particular question. Like I said, at the hospital, we have a new vision. That vision, like I've mentioned, is to rank among the top 3 in the country by the year 2030. So it's a 10-year plan for us from 2021. And ultimately, we also aim, if we continue on our trajectory of success, we also aim to become the best in the country. Nothing says that we cannot achieve that. It's achievable. It's all doable. It's all about the will. Okay, so one of the important pillars in that our development plan is partnerships and collaboration. Partnerships and collaboration, we understand clearly that the federal government cannot do everything. The government cannot do everything for us. So we keep reaching out to stakeholders who will help us attract projects, who will help us attract programs, who we can leverage on their experiences, resources, and all that to be able to develop the hospital. And so that is what we do. So by the coming of the vice president and the anniversary and the coming of everybody who are going to be around with him, it is our thinking and it is our wish that the hospital will leverage on that he's coming. I mean, this is the #2 citizen of the country. And so we're going to present the hospital to him, which I know he will present to the Mr. President. He's going to see our challenges. He's going to see where we have succeeded. He's going to see where we have the obvious challenge. He's going to be at the hospital. So because we have need, we want to do a cancer center, we want to do a transplant center, we want to do a cardiac center, we want to do an IVF center. So we're going to provide all those to him. And we are hoping that somehow he's going to help us, either by interacting intervention or speaking to relevant stakeholders and all that to come to our assistance. So it's all about, you know, getting to our vision, using that strategic pillar, which is collaboration and partnership. He's not coming alone. A lot of people are going to come around him. And we've also invited a whole lot of stakeholders in Anambra State. All the rich men in Anambra State are also going to be around. And so we're going to have a stakeholder interaction during his visit. And we present the hospital to them. You see, it is my belief that the development of public institutions should not be left to governments alone because of what is happening. And so when we have that stakeholders interaction, we present the hospital to everybody. They see where we've done well. They see where the obvious challenges are. And we are, I believe, and we are hoping that somewhere along the line during that interaction, we will be able to attract. You see, we are lucky in Anambra State because we have individuals in Anambra State who are interested to partner with public institutions to develop those institutions. All you need to do is to demonstrate vision. All you need to do is to earn their trust. All you need to know, for them to know that you're genuine and you're genuinely interested in developing your institution, they will come to your help. So at this particular event, with the coming of the vice president and all the stakeholders together, and during the interactive section, we are hoping and praying that somewhere along the line, during that meeting, we'll be able to attract 1 or 2 more projects in these key areas I've mentioned. We are in dire need of cancer center at that center, and it is of course, you know, it's capital intensive. We also want to do our renal transplants. We've trained people. All we need are equipment. The structure has also been built. We also want to start our interventional cardiology practices, open heart surgeries. The building is already there, but we need the equipment, and we've trained some of our manpower. And of course, we also want to do assisted fertility practices, IVF, because of course we know IVF practices in the private sector is a little bit above the affordability of the common Nigerians. And so by bringing it into the public sector, I'm hoping that it will become available to more Nigerians. So these are our key areas of need that we're going to talk about at this visit. And we are hoping that somewhere along the line, we'll be able to find some solution to some of these challenges.
Yeah, Prof, sounds like you have a big strategy there, connecting the event, you know, to your target and all of that. But I know you had said at the beginning of this conversation that you're impressed with the work of President Bola Tinubu's administration and the funding that's coming to the sector. But when you look at the health sector generally now, what other reform or attention do you think is urgently needed to make the sector even better than it is at this time?
It's okay. Thank you very much. I think for now at the health sector, for some time, I think we have the best leadership profile. The combination of President Bola Tinubu and our coordinating minister, Professor Muhammad Ali Pate, CON. And if you've been a keen observer or a participant in what has been happening in the health sector, you realize that in the last 3 years or so, a lot has gone into the place. A lot has gone into the place. The minister came with a whole lot of experience in terms of how to organize the sector. And the ministry has come out with 4-pronged approach to their own strategic vision and mission, which some of us at the peripheral end are trying to copy. And so you see a whole lot of things happening within the sector. You see, it will take a while before Nigerians will feel the whole gamut benefit of it, but it's beginning to happen. The indices are beginning to change, with the increased funding, building infrastructure at the required places. You see, for me as a person, I keep telling people, even to my colleagues, it starts with leadership. Once you have the right leadership, you see, a whole lot of things become easier and all that. So with coming of the minister, with his experience and all of that, the place is more organized now. If you visit our hospitals, in fact, for information, I'm hosting the committee of CMDs, even about the time I'm doing the anniversary. That meeting is starting on the 8th, and we run through 12th. Now, if you come to that meeting will bring together all the CEOs of the teaching hospitals, federal medical centers, specialist hospitals, and we discuss. And if you look at the profile, you look at what hospitals have done, you will marvel at it. And these things are happening in the last 2 years or so. And so we've seen it. And all I'm hoping is that we continue in that trajectory. Because once you have the right funding and you have the right leadership with the right strategy, things will happen, things will change. So Nigerians are beginning to have new leads of life. The indices are improving, courtesy of the increase. We know we are not there. We know about the Abuja Accord, 15% of national funding. This year, I think it's a little bit above 5%. The health spending with respect to the total national budget. But that is a significant improvement in what is happening. And so I know that the system has changed. I know that the hospitals have become better. I know that the leadership corporate governance has become a whole lot better. And then the patient outcomes have changed greatly across all hospitals. I'm just hoping that we continue on that trajectory under the leadership of President Bola Ahmed Tinubu, supported by our coordinating minister, Professor Muhammad Ali Pate, CON. I believe we'll get there. It's just gradually. Rome is not built in a day. But I can assure you that a lot of things has changed in the health sector. If you are going to be around during my anniversary, you see that hospital. The hospital showcases what the federal government is a showcase of what is happening in every other place. Like I told you, when we came on board, there was nothing in that side. But with the help of Mr. President and this particular minister, we've been able to build a whole lot of infrastructure so that we're able to move within a short space of time. So that is what you see happening in all the zones of the country, in all the other hospitals. So a lot of activities are happening, and I believe that patient outcome has greatly improved. Given that we may not be there yet, but I believe if we continue in this trajectory with the right leadership, with the correct strategies, with the correct funding, definitely, Nigerians will have a better health sector. That is my belief. Thank you.
All right. Thank you so much, Professor Joseph Ugwaja, the Chief Medical Director at Nnamdi Azikiwe University Teaching Hospital, and we wish you the best in your celebration.
Thank you.